Hey guys, welcome back to Hearts for Motion. My name is Miriam, and today I'm going to be talking about collateral circulation, or in other words, a DIY bypass surgery. Let's start off by talking about what a bypass surgery is. The full procedure is called a coronary artery bypass graft, or CABG for short, and it's pretty much redirecting the flow of blood around a full blockage in a coronary artery, using a saphenous vein graft that's usually taken from the leg. In comparison, collateral circulation is also a redirection of blood flow, but it takes place through the body's natural ability to create new blood vessels called angiogenesis. If we take a look at this picture, specifically the blood vessels on the right-hand side, you can see that a network of vessels has formed around a narrowed portion of the artery. This is what it looks like in general. So how is this process going to help the body exactly? For starters, it will limit the damage that can be caused by heart attacks. Tissue death during heart attacks comes from a cutoff of oxygen supply to the tissue, and collateral circulation is going to help reduce this damage by providing a redirected path for the oxygen to flow. This in turn is going to provide extra time from the moment a heart attack occurs to the moment that treatment is necessary and will be required. And ultimately, it's going to improve your chances of survival. So now that we know more about angiogenesis and collateral circulation, let's talk about how we can activate this process to get the body to heal itself naturally. You guessed it, exercise. The first study that I want to look at talked about exercise training and the impact that it has on overall coronary collateral circulation. This study was a review article published in 1996. It took into account all previous studies that were performed to test out the theory of whether exercise actually improves collateral circulation. They compiled evidence that had been extracted from animal studies as well as human trials. The main findings from the human trials were overall positive and showed a significant impact on heart function. For example, it reduced clinical symptoms such as angina pectoris. Angina occurs when there is a reduction of oxygen supply to heart tissue, but no actual cell death. When there is cell death, it would be called a heart attack. It also improved heart function by improving aerobic capacity, which is the heart's ability to provide and carry oxygen throughout the body. Ischemic thresholds were also improved by about 34%, which is the heart rate during a symptom-limited exercise test where angina occurs. So in plain English, when you're getting a stress test done and you start to have chest pain, this is known as your ischemic threshold. We want this specific heart rate to increase after training so that your heart can work at a higher workload without getting those chest pain symptoms. It also reduced long-term cardiac mortality as it increased the chances of survival after a heart attack. The second study that I want to talk about had a stronger emphasis on the difference between moderate and vigorous exercise intensity and the impact that each of these exercise parameters plays on collateral circulation, VO2 peak, and ischemic thresholds in patients with stable coronary artery disease. So this study was published in 2016, and it focused on the difference between moderate and vigorous intensity. They took 60 participants with coronary artery disease, and they put them into 3 groups. The first one was a moderate intensity group. This group specifically reached about 60% of their ischemic threshold heart rate. The second group took a more vigorous approach, and they went to about 70%, with partial intervals reaching about 90% of their ischemic thresholds. The control group was called a usual care regimen group, and this was just a group that was encouraged to exercise 2 to 3 times a week in 20 to 30-minute sessions. After about 4 weeks of this intervention, they noted significant changes in the moderate and vigorous groups, but very minimal to no changes in the control group. If you look at this chart, the first row shows the percent change in collateral blood flow, which was measured through something called coronary catheterization. This is known as the gold standard for measuring collateral flow index. They noticed an improvement of 41.3% in the moderate group and 39.4% in the vigorous group, compared to an insignificant 0.7% in the control group. The VO2 peak is the testing that we use to measure aerobic capacity, which I explained earlier is the heart's ability to provide oxygen to the rest of the body. This improved by 18.5% in the moderate group and 12.9% in the vigorous group, compared to 2% in the control group. And the third measure was the ischemic threshold, which, like I mentioned before, is the heart rate during a stress test when you start to feel severe chest pain. This improved by 23.4% in the moderate group and 11.9% in the vigorous group. The reason I highlighted these two numbers in red is because the moderate group actually had a lower ischemic threshold average to begin with compared to the vigorous group. They both ended up increasing to about 132 beats per minute before they experienced chest pain, but the increase average looks much bigger in the moderate group because they started off with lower numbers. So to sum up the study, both exercise intensity groups showed significant improvements in collateral blood flow, aerobic capacity, and overall ischemic thresholds. One thing to take into consideration regarding these studies is the fitness level of the participants. Considering they were all diagnosed with significant coronary artery disease, we can make the assumption that their fitness levels were low to begin with prior to the exercise intervention. This is important because the exercise intensity recommendation is going to differ based on someone who has an inactive and an active lifestyle, regardless of family history and unhealthy lifestyle behaviors. If you are diagnosed with heart disease and you want to start incorporating exercise into your daily routine, it would be best to consult a clinical exercise physiologist so that they can create an exercise program individualized specific to your personal risk factors and lifestyle habits. However, if this is not an option for you, you can still get the benefits of exercise. All you have to do is go into your closet, find your comfiest running shoes, and go for a brisk walk for about 30 minutes per day. This simple addition to your daily routine is going to drastically impact your heart health, and it's free of charge. Thanks so much for tuning in. I hope you're able to learn something new. For more information about basic heart health and cardiac rehab, check out my Instagram page @Hearts4Motion, which I'll link in the bottom description. Until next time.